Good morning, Dr. Stella. The short DAPT is a real hot topic, considering the high number of complex and frail patients to be treated. Moreover, the definition of short DAPT is very different in several clinical trials. They go up to 6 months. But in my opinion, the real challenge that we face is the 1 month DAPT, that it's real short DAPT. And your study, the ReCre8, faced to this hot issue. Would you detail us the ReCre8 randomized trial design and the main findings of this study?
Yes, good morning. Thank you, Reno. The ReCre8 study was designed with 2 objectives: short DAPT in troponine negative patients and stratification for diabetic patients. In 2 stents, the ReCre8, in which we had good experiences in the past, and the well-known permanent polymer stent, the Resolute Integrity, which at the time of study design was the only CE-approved stent with a 1 month DAPT. As you can see on the slide, the primary endpoint was met. This was presented at TCT 2018. There was no difference in target lesion failure at 1 year follow-up.
Thank you, Peter. In the new consensus about high bleeding risk, 20 clinical criteria were defined as major or minor, and patients are considered to be at HBR if at least 1 major or 2 minor criteria are met. Did you reanalyze the outcome of these patients according to the new HBR criteria?
Yes, Reno, thank you for the question. So, in fact, what we did is reanalyze according to the new criteria the ReCre8 study, and we looked at especially the new criteria for the high bleeding risks. And as you can see in the slides, in the patients who only had 1 month DAPT, you see there's a difference in bleeding outcomes according to the new criteria at 1 year follow-up. So it almost doubles from 1.3 to 2.6% bleeding, although these patients have only 1 month of DAPT. As you can see in the lower bar of the same slide there, of course, most bleedings are within the first 30 days. If we then look to the next slide, and this one is impressive, is that if you look in the same patient population, but overall, so the group of 1 month DAPT versus the group of 12 months DAPT, you see there's a huge difference in bleedings again after 1 month. So in the patients who don't have DAPT anymore, there's a slight increase in bleeding risk, 1%. But in the patients who are defined with a high bleeding risk and indeed are taking DAPT, the bleeding risk increases to 3.5%.
Thank you, Peter. Great data. But we know that beyond the bleeding risk, we have also the ischemic risk, and the diabetics are for sure the most difficult scenario to achieve this balancing between bleeding and ischemic. Which are the outcomes of diabetic patients inside your study?
Yes, Reno, thank you. So you're coming to a personal interest of me in this study now, the diabetic patients. So as you can see in the slides, there was a difference in target lesion failure at 12 months follow-up in all diabetic patients of 4.6% to 7.2% in both study arms, which was not significant. And if you look at the insulin-dependent patient population, there was a significant difference between the ReCre8 arm and the Resolute arm, where we had a target lesion failure of 4% in the ReCre8 arm and almost 15% in the Resolute arm. So it seems that this stent really does the job in this specific patient subset.
Thus, at 1 year, the difference between Resolute and ReCre8 it's not significant, but it's quite significant. It's my feeling that increasing the follow-up, maybe we will achieve the significativity between Resolute and ReCre8. What is your comment, Peter?
Yes, indeed, Reno. So that's our hope. We are doing a 3-year follow-up, clinical follow-up, as you know, and hopefully we see this and we see a significance reached, and we hope to present this at late-breaking trials, upcoming TCT.
Do you think that the real challenge is to balance ischemic and bleeding risk to have a very good DES best performance?
Yes, Reno, thank you. I think that's indeed the challenge. We want to have a stent which combines efficacy, so it prevents re-intervention within a couple of months, therefore increase the risk of, again, bleeding. So the combination of safety, efficacy should really pay off in these high-risk patients.
Thank you, Pieter, for this great data, the great results that increase our confidence with all these DES for the future. Thank you for your participation, your support.